So one of the features of EASD here in Barcelona is the number of patient associations from all over the world that are represented. And I particularly wanted to talk to some of them, and we'll be scattering those throughout our coverage. But I'm joined now by Matt Petersen from the American Diabetic Association. So first of all, why is it important that a patient association like yours is at the EASD?
Well, this meeting and our scientific sessions that takes place earlier in the year are the two primary places in the world each year where new scientific discoveries are announced and where they're discussed, where they're critically analyzed, and where we really move forward with an understanding of what is going to be best for patients. So it's the first important step in making sure that something is really going to be of help. And then we look at, including during these meetings, what are the right ways to implement things with patients? What are the strategies that work? Because a big component to this meeting and to our scientific sessions is about education and communicating these scientific discoveries and their relevance to patients in a way that's useful for them.
So what are the big things that you're looking at as an association at this meeting? What's making your heart beat faster?
Well, I'm going to answer that in a slightly different way. In a little while, I'll be going to a small meeting that's a work group of the American Diabetes Association and the European Association for the Study of Diabetes on a paper on diabetes technology. So a lot takes place. There's the major presentations where we've got announcements we expect to show more advances in new medications with significant improvements for cardiovascular disease and kidney disease in people with diabetes, for example. I think that's the most exciting thing going on in diabetes in general over the last couple of years. And each of these steps is critical. We've had the good news, but this reinforcing good news is important. And sometimes we get news that we have to step back and say, oh, that didn't have the benefit we expected. How are we going to work this out? And ADA and EASD have been working closely for several years now on just how to interpret that. I think you may know that our joint guidelines on treatment of type 2 diabetes have had enormous impact in how diabetes treatment has changed in just the last couple of years.
But I'm very struck, you said about devices, and of course as far as the patients are concerned, the devices are the things that they use to monitor their diabetes. And sometimes I guess that devices get second billing, as it were, compared to some of the pharmacological interventions. But actually for the patients, they're the thing that is uppermost in their minds. So what are you seeing here in terms of devices and diagnostics for patient use?
Well, we've been seeing the development and the release, the availability of continuous glucose monitors of different kinds that allow a much more flexible measuring of blood glucose compared to just 5 years ago, largely, and all the time before, where finger sticks were the norm, and they work, but they don't tell you as much as continuous glucose monitoring. That has advanced tremendously, and obviously pump technology has advanced. I think what's important about this meeting and ADA and EASD working together is we are significantly influencing what the payers will actually cover for their patients. Patients can only use what they can afford to get. The devices we're talking about are expensive enough. We need governments, insurance companies in the US, these entities to cover things. Well, they're cautious, they're conservative, and they really want the green light from our organizations to say, yes, this is something that we should pay for our patients because it significantly improves quality of life.
One final thing to turn to, which is about interventions, because we're seeing a lot all around the presentations about interventions in terms of diet, so that people don't get diabetes in the first place. Population health measures. How is your association approaching those kind of things in educating the public, I guess?
That's a great question. We are, of course, sincere when we say that the foundational intervention for all people with diabetes, type 1 and type 2, is lifestyle intervention. Some people, particularly with type 1, I think, come quickly with their diagnosis of diabetes to a far healthier diet and exercise regimen than they had before. A lot of people say they're much healthier once they're diagnosed with type 1 than they were before. And with type 2, that's absolutely true. ADA released a new nutrition position statement just a few months ago that really was an impressive step forward in very carefully listing out the various types of diets, Mediterranean diet, a keto diet, and what their proven benefits and unproven possibilities are. So we are have long recognized, but we're being more detailed about the fact that not one diet works for everyone, and to really encourage people to realize that they can find something that's healthy that will work for them, that they can live with. They enjoy the foods they can use, and keep with it, because the only diet that's successful is one that you will follow.
Thank you very much for joining us, and I'm delighted to have a patient association here. Patients really matter. We always talk about patients at the centre of everything, and I think we really need to walk the walk as well as talk the talk.
That's a pleasure. Thank you so much for having me.
Thank you.